Welcome to the Mindset Matters, the podcast where psychiatry, medicine, and real human experiences collide, all through the eyes of two psychiatric PAs.
We're your hosts, PA Mercedes Dodge and PA Jessica Spissinger, two passionate psych PAs on a mission to bridge the gap in mental health care.
So whether you're a provider just here to level up your psychiatric insight, increase your mental health skills, you're in the right place.
Each episode, we shine a light on the incredible work PAs are doing in psychiatry and beyond. Our goal is to build a community focused on better patient care, professional growth, and personal well-being.
This podcast, a little disclaimer, is for educational purposes only. We're not here offering medical advice, psychiatric advice. If you or someone you know needs support, please reach out to a licensed mental health professional. All right, guys, let's dive in. I am super excited to introduce Jo Hughes, who is an outpatient psychiatric PA for more than 15 years in psychiatry. She has a strong foundation also in emergency medicine, and I really like and love her unique lens about medical training, how that shapes how we provide psychiatric care. So I'm just so super excited. I can go and talk about her too much, so let's just move on. Jessica?
I'm so happy to have you here because we've been working together for a couple of years. I've been very honored to work with you with the Association of PAs in Psychiatry as president. I'm now past president. I realize there's still so much about you that I didn't know. So I'm so excited to really know more about you. One of the things that you mentioned was how much you love the brain. When did you make that shift into psychiatry?
So, first of all, thanks for having me on, guys. I'm big fans of yours as well. And I'm so excited you've done this podcast with PAs and as the forefront and bringing us to the light, especially in psychiatry. So kudos to you. I appreciate the work you're doing as it just keeps PAs interested in psychiatry and that, hey, this is something we can do. What got me into psychiatry, that's kind of an interesting story, was I'm the oldest daughter of two of in my family, and there's quite an age gap between myself and my next youngest sibling. And I was kind of tasked with the ear of the family in a lot of ways. And growing up, so I kind of had this role within my parental relationship that I was kind of a go-between and kind of a sounding board. So I think it was kind of bred into me at a very young age to kind of be a listening, absorbing kind of person. And then growing up, I didn't really believe in myself enough at the time. My parents have 5 degrees between them. They're very educated, and I did not feel very intelligent, honestly, when I was 18. And didn't really have a goal in mind about what I wanted to do, and I just knew I needed to expand and figure out who I was. But I didn't know what my future was going to be, but I knew I needed a degree. So I went to school and got a business degree. I'll figure it out later. Well, I happened to meet my husband in college, as many of us probably do, that story. And we met 35 years ago this month. And so going through school, met my husband, started having some children, and had some medical issues with children along the way. One child who was stillborn with trisomy 18, full term. And then I had my next child has a genetic condition called Soto syndrome. I had these kind of medically fragile, interesting cases within my own family. And then I was at home with them for 10 years. And my husband was the breadwinner. We moved from the Chicago area to North Carolina. I was in the community. Our oldest daughter was starting kindergarten. Our youngest, the one with Soto syndrome, she was 2, and we were joining different clubs. I was trying to integrate into the milieu of middle class and swim clubs and being a mom, a stay-at-home mom. And I had this pinnacle aha moment when I realized every time after I left the swim club with my family, I was irritated. I was angry. And I was like, what is going on? What do I be angry about? I didn't see myself really engaging in this was my future life of tennis and bunco and talking about each other's families and children and husbands and, just the chatter that goes along sometimes in those communities. Unfortunately, it just wasn't for me. So, and also having a child with special needs separated me from that group in a very distinct way. So I started looking at myself internally and what my future was going to look like. And having the support of my husband, decided that going back to school, I've always had a passion for medicine. So I started investigating in my community about how I could do that. And I decided that PA program was probably the best way for me to go, given my 4-year degree of business and my interest in medicine. I was given 2 choices about where to get my clinical specialty hours, right? It was either a CNA or an EMT basic. And I went work in a nursing home, caring and tending to a lot of daily basic needs. or drive an ambulance. I'm going to do option B. I went into a class of 52 firefighters as a civilian, one of four women, actually, that were in this class with all these firefighters, because every firefighter in my community has to graduate with a basic degree before they can fight fires. So the good thing for me is I got to meet all these wonderful human beings in this class that were going to be scattered throughout my community. It was quite a jump into education after I'd been out for so long. And so I really got my feet wet as a part-time EMT basic, working nights, days. I like to say I was the gum on the shoe of the paramedics. It's a very hierarchical, militaristic organization. One of the best human beings I've ever worked with. It was an amazing experience to go into people's homes and to see how their whole world and environment shapes who they are. And I think that truly for me was the most eye-opening, right? Working in emergency medicine really gave me such a humbled beginning to how everything is affected. Like the whole environment. We walked into homes that had cockroaches scattered all over, but then there was this one area in the bedroom was pristine. Just how people and the physiologic aspects and socioeconomic status can really affect the mindset, behaviors, emotional needs, physical needs. It was amazing. And I learned so, so much. And it was probably one of the best experiences of my life, to be quite frank. And then I got into PA school. Wake was allowing me to have the second year clinicals to where I wanted to be in the community I live in. I started going to Wake Forest in 2007, graduated in 2009. Working in emergency medicine, which I did for 4.5 years, really helped shape the clinician I am today. I've diagnosed tertiary syphilis in my psychiatric space. I've diagnosed broken arms, rashes, lacerations. I've helped. It never leaves me, right? And I'm very, very grateful for that. And then psychiatry just kind of morphed out of that. I had one little opportunity my first year into emergency medicine where it was a center that treats substance use, and a friend of mine said, "Hey, do you want to come in here? They need a provider about 1 day a week." And I was like, well, with my ER schedule, I could swing that. So I started going in there, and I had two medications I was really comfortable with, Prozac and Abilify. And that was about it. So during that time, I really started expanding and went, you know what? I really kind of like this. I like the continuity of care that I don't get in the emergency room, and the hours, so much better. And then a sales rep friend I made during that time, he recommended me to talk to another outpatient psychiatrist who had a big practice in our area. So I did. And he said, "Yeah, you want to come work?" And I went, I love the brain. I was always fascinated by it. And that's how I kind of got into that space. What I've discovered in life, and mostly in this profession, is if someone goes, "Hey, do you want to do this?" And I'm say yes. Just walk through the door. You can always close it later, but walk through it if it makes sense, and it's a risk. He presented doors to me of working inpatient psychiatric care. He presented telehealth with emergency room consultations. I opened a Suboxone clinic with him as the medical director in Fayetteville with a group, but that was a really fun experience. And so I got to do a lot of things because I just said yes.
Yeah.
Yes, we'll figure it out as we go, right?
I love that. I mean, your origin story has so many chapters. One of the things that Jessica and I have discovered is that every PA that we've interviewed has many different ways that they got into psychiatry. And it was true to their path and who they are. And so for you, you've had these lived experiences as a particular role in your family, being the glue, the connector, the communicator. And that skill set really helped you bouncing into these chaotic environments. There is something beautiful of that human connection. Like you're seeing people in the most vulnerable space, and you really have to really blend in. I'm here to support, regardless of how this looks. You treat patients or treat people that are in the mercy, regardless if they look different from you. Juggling all of these opportunities can be overwhelming to many PAs. It's like, well, what do I say yes to? What do I say no to? Because, we want to prevent burnout. But I think you highlighted saying yes to things and learning has built your CV. Right. And now you're a leader with APAP and you're a mentor and you own your own business now. How do you juggle being a working mom now with individuals with kids with special needs and doing your business?
So first of all, I couldn't do any of this without the support of my husband.
Nice shout out.
True. I mean, when I was a stay-at-home mom for 10 years, and when I started this journey back into medicine with the basic and going on to school, and he was in sales at the time, and he was able to he got a job that put him in the house. So as I was leaving the house, he was able to come into the house. And my youngest started kindergarten when I started PA school. So I have 3 children. My oldest currently is 30, and she's married to a woman who is actually a captain at the same EMS organization that I was at so many years ago. I have a 4-year-old grandson. My daughter also just graduated law school, and I have a 27-year-old daughter now, my intellectually disabled daughter, with the one with SOTOs, who doesn't live with me in AFL. There's kind of 3 generic ways an individual who can't live independently, who has intellectual disabilities, can live outside of the family home. One is a group home, which can be up to like 3 to plus members living under the same roof with an organization. And then 2 is what's called AFL, which is alternate family living, where my daughter lives in another family's home where they essentially act as her guardians, caregiver, daily caring for her daily needs and kind of incorporating and organizing her daily life. And we see her often, like every week. She's with us one night a week, and we see her at the coffee house that my husband and I helped get started, A Special Blend, and which is a nonprofit coffee house for intellectually and developmentally disabled adults. And then there's also supportive living, where individuals can live in their own space that they rent, and then they have 24-hour staff coming to them. Our son is 23, and was drafted by the New York Yankees in 2024, and he's currently a pitcher in the minor leagues in that organization. How I manage that, I didn't start this business until we're now 2 years in, and everybody's out of the house. So really right now, it's my husband and I. Don't know if I could have done this earlier days when they were in the house. I kind of joke that this is our another baby because my husband has just started coming into my practice and learning more. And my business is 2. So she's a toddler and she's learning to walk and start to say some words. She's a little sassy, and we're raising another child. And we happen to do that pretty well.
First emergency medicine and then into psychiatry. And then you did like kind of the addiction element as well. And so now then you've launched your own psychiatric company. I'm curious, given all the exposure you've had in this field and like now you are like truly a leader in the field, you have kind of an approach that you take with you?
One of the areas and populations I focus a lot on and that I see a lot is the IDD and autism society, population. I have a personal connection, obviously, as I mentioned, but also a professional one. And so I really have a big passion about them. And managing this population is no easy feat by any means. Before I opened a practice, I got my doctorate of medical science from Rocky Mount University with the psychiatric clinical focus. And that clinical focus for me was amazing. And honestly, I wasn't expecting that, to be perfectly frank, but pleasantly surprised because I had 2 classes on therapy, especially the motivational interviewing. And where I struggled a lot in my practice was those patients that kind of take everything out of you and they come in and they just kind of suck the energy and you're just like, oh my gosh, I just run a mile. And this motivational interviewing technique has really saved my sanity and my emotional burnout from fizzling, because I can utilize those skills that really help put it back on the patients. If I'm working harder than they are, there's something wrong. If I get one yeah, but, and here comes the motivational interviewing technique. What might work best for you? What has worked in the past for you? So it really helped me refrain from me trying to solve it from them to put it back on them. And I think that was a skill I definitely needed.
I love speaking about motivational interviewing and psychotherapy. Jessica and I, we have a love for that. She was a social worker before she was a PA. I'm kind of similar to you, Joe, as in I'm in there, I'm going to solve it. I'm the glue, I'm the communicator. And so flash forward as a clinician, yes, I tend to fix things. I'm a problem solver and I have to put the pause button. Because guess what? Oh, like you said, I'll get emotionally exhausted when I'm trying to fix every family that I interact with. And that's not my role. My role is just to be a guide. And so I think motivational interviewing really taught a lot of us, and it sounds like for you as well, is that we are part of the process and the team. We are not going to solve the patient or family's issue completely that 15-30 minute visit. But if they hear that they're being heard by you, they're going to come back. And there's might be some steps forward in their problem. There might be some back steps, but we're just dancing and we're standing by them.
And you're right, because we want to fix, right? I think as people, we go into this profession to help, right? So how can I help? And in this moment, I'm listening. I think one theme I always try and keep at the most forefront is respect and dignity. And that started in my EMS. I mean, that started my whole life, but in my EMS days, there was an individual, and he is deceased now, who weighed close to 800 pounds. And the first time I met him was in his home. We went on the call for a stroke. Well, there was this tubing that was kind of up and intertwined throughout the door frames and all over the place. And then after we were done kind of assessing that her stroke was probably a TIA, I was able to kind of trace this. And I go to this room next to the room where the mom was. There's this TV on the ground. And then on the ground is this head that pops up at me, looking up at me and talking. And I couldn't see where he ended and began because literally it was this dark room, but except for this light from the TV on the floor, he was living in the floor, and he couldn't lay down because he would suffocate from the weight. It was the most bizarre thing I think I've ever seen. Of course, he wasn't our patient, so we just kind of moved on. And he was on 2 beds pushed together, laying diagonal. He didn't fit in any of the machines. How humiliating, right? But I have to say, what really astounded me was the fact that my EMS crew all treated him with the absolute respect and dignity of any human should be treated. Even while we're moving him, it took 20 of us to move him, lift him up. It was just so astounding, that level of dignity. And I was so proud of that. I think everybody deserves to be treated with dignity. And I kind of keep that in my head.
The central premise of just, being respectful, treating people with dignity. There's already like stigma in mental health, but then there's like layers and layers of stigma within stigma, right? It's like a nesting doll of stigma. And I was thinking about like the population you work with, you keep saying IDD.
Intellectually and developmentally delayed.
And that, of course, is a spectrum with
Yes.
regard to like functioning. And so I'm kind of trying to picture like what that clinical work looks like for you. Is it sometimes one-on-one?
Sometimes there's 12 people in the room. And actually, I don't
That's what I
go
was
into their
picturing.
homes in my current, they all come to me because then I can do vitals. But the IDD population can consist of usually intellect an FSIQ under 70. Not likely to live independently, will always need some sort of support of some sort. But yes, it can be 12 people because it can be the guardians. It can then be the support staff and the QPs.
What's a QP?
A quality professional. And a quality professional is someone that will oversee the entities of a group home or an AFL or the supportive living. There's a lot of middle managers. And for every group home, there's an entity that will control the hiring, the management of funds, the oversee. So QP is kind of the middle manager above the living situations. And then there's their bosses. And then sometimes you get the owners that kind of have a vested interest.
If there's a full like group of people in the room, like those appointments must take a while, right? I can't imagine going through that in 20 minutes with everyone having to want to maybe like share a little piece of their perspective.
It kind of, I feel like a maestro, and I'm like, okay, and now you, and you have anything to add? Okay, and what has your observation been? Any concerns? It's like, and go. Music plays and go.
And I'm just thinking, like, how do you manage that piece, like the collaborative element there? Because you probably also have to kind of be hearing from primary care.
There's not as much collaboration as you would think. And it's not for lack of trying, but I think that a lot of times these are very complicated folks. And a lot of times they're on a lot of psychiatric medications for a variety of reasons. And a lot of providers kind of go, I'm not touching that. And they don't want to deal with it. So understood. So I think they kind of get lost in the shuffle a little bit.
I'm glad that we're talking about this topic because, as I teach in PA school, I find that we really we do like kind of a disservice or underrepresentation of genetic disorders that can lead to disability.
100%.
And it's like nobody knows where they're supposed to live. It seems, sometimes they might like pop up in endocrine, sometimes they pop up in neuro, sometimes the developmental delays, they don't always want them in psychiatry, they want them in pediatrics. And I'm always like, where does this all live? And there's kind of like no big bucket that really encapsulates the diversity.
It's like
of
hot
the
potato.
presentations.
It's like
It
hot
is.
potato. Who's gonna hold it? And it sounds like you created this space, Joe, that allowed people to feel like she is a trusted caregiver and clinician, and they can come to you not only because you're so well educated and you have, great motivational interviewing skills, but you also have lived experiences. And that's one of the things that I continue to see in a lot of our PAs is that our lived experiences really create us as a pretty superb clinician, a psychiatric PA. And I think that is why you do what you do so well, is because you are humble, you've seen it, you've seen the cracks, and you just want to be the bridge and helping those caregivers and those guardians, patients.
It is. Having lived it so much myself, and I still live it. My daughter, she has a genetic disorder, and then she developed Hashimoto's thyroid disorder, right? That was something. A lot of the times in my office with all of these pieces is I collect them for patients and I try and be that sounding board to guide them. A lot of like also in the academic setting with these kids, parents who don't understand what guardianship is and how to go about that. So I've educated a ton on what that looks like and telling them the step-by-step process. You go to the county clerk. You declare your child incompetent. The sheriff will then deliver a notice at your door to your child, hand them a piece of paper and say you're being declared incompetent by your mother. Then a guardian ad litem will come and represent your child. You have to have separate representation. They will do their due diligence, you will do yours, and then you'll have a court date in front of the county clerk, and you will present your side, and your child's guardian ad litem will present their side. The county clerk will then decide if this is enough evidence to declare the person incompetent. Once they're declared incompetent at that moment, me and her dad, which we did, could request to be guardians, and that was granted at that sitting. So people don't understand.
Yeah.
Like anybody who's declared incompetent, this is how the process goes.
So, like, knowing that you've lived that, I actually have a patient who's gone through, like, a recent guardianship situation with his son who's about 21, pretty significant autism, also in a residential setting right now, lost custody, on getting custody back, and I've really felt a little bit at a loss in terms of, like, what resources and referrals I could bring into the picture for him. Do you feel like there's any, like, that are your go-tos, or is it state dependent, state specific?
I will say this, if they have autism, the Autism Society is a really can be a very well-run, organized group. There is a Soto syndrome group, but I didn't ever really identify with it. I tried at the very beginning when she got that diagnosis, but I realized quickly that the websites and internet wasn't as big as it is now. How do you get through this? It was just the worst of the worst. I wish there was a better collaborative. I really do. If you get one person that you can contact who has a heart for this within your community, treat them to dinner, buy them wine, buy them flowers, make sure that they're a part of your organization. It's a good resource. It may be with the Guardian Ad Litem office. It may be a caseworker who works for the Medicaid or Security disability offices. If they have a heart and passion for this, it might be a caregiver or who's just gone through it. They come to me and then they'll give me their tidbits about what's working. When there's money involved in these individuals with their care, and it's not advertised what's available. For instance, in Guilford County, there's something called Innovations Waiver, which is the Cadillac services for these individuals. We were on the wait list for 16 years for my child. 16 years. It's really follow the money, follow the lobbying, follow all of that. And that also leads you down to a very big road of frustration. I'm just not going to lie to you. But a lot of families don't know this, and they don't know that there's a workaround while you're on the wait list of unmet needs. And so having to navigate, I'll go, hey, have you heard about this 9 criteria? You meet this, go talk to them about that. Because nobody will go, you're on the list, here are some things you can do.
You are such a big mega learner. You know so much. A psychiatric clinician juggling as a mom. What are your easy to go places to learn?
Honestly, I learn from all of you all, like I'll talk to people and they're like, hey, have you seen this study? Honestly, too, pharma has been a really amazing connection for me as I became a speaker. And I had the opportunity of learning with these amazing individuals who now I call friends and I'll call them up. And so I get a lot of pointers from them. Honestly, presenting on a variety of medications has really broadened my knowledge base. And I'm constantly looking, and if it's coming my way, I'm like, ooh, yeah, I want to know, or hey, I need to know more about that. Yeah.
So, just thinking of like how much you've taken on, like with pharma, with like running a business, being president of APAP, like speaking at like national conferences, like, do you ever get any time for yourself to like breathe and unwind?
It's funny. Yes, of course. Actually, I'm at the beach right now with my husband for the weekend.
Ooh, okay.
Again, not having the day home life responsibilities as raising children, but I think having a really amazing partner in life who supports me, who makes sure I have food, who emotionally is here is it's been the only way I could have done it. And having just wonderful people around, it feeds me, right? Like this doesn't feel like work. So it's fun,
That
you know,
helps.
and it's never work if it doesn't feel like it. I mean, at times it does, of course, and I'm exhausted. Yeah.
Yeah. I think the 3 of us are probably cut from the same cloth there. But I
I
think
think
you
so.
mentioned that you like to run. I'd like
Yes.
to hear a bit more about the role that plays.
One thing I try and do every morning is run. I run on a treadmill in my underwear in the basement where it should
Mhm.
happen. And I give my brain a break and I watch a bubblegum TV on my iPad, 911 Nashville or
Mhm.
ER reruns. And it's about 20 minutes that I allow myself because I hold a lot of tension in my body. And that really just helps kind of center my brain. It gives me clarity. The endorphins are there. I relax and I can hit the day. And it's been very, very helpful for my emotional well-being. I'm not gonna lie.
Yeah,
Yeah.
it helps. But not like the road runner,
No,
marathon-y,
because I
5K or
no, no.
that's not the goal.
I've done a few 5Ks, but they were for special needs, for women's breast cancer, but that's it. I have no aspirations, like the competitive drive of running and
Oh,
with the that's not me.
that's not what they're there for.
No, I run to clear my mind, to drink red wine and eat dark chocolate.
I think it's really fun to like kind of learn where we are in our life and just what we enjoy and what brings us joy. And like, I think that ultimately your story is just so inspiring. And I'm just so thankful that we're able to like dive into you and your story and kind of really understand IDD a little bit more. Thank you for taking some time from your Valentine's weekend to, share some of your stories and some of the joys in life and practicing in psychiatry. For our listeners who want to connect with you, Joe, is there anything like LinkedIn or
On Saturdays and Sundays, I did just post some pictures of my family. We took family pictures, so I put them on Facebook because that's just a
Mhm.
fun thing to do. A little secret pleasure of seeing the comments about folks that I don't see very often and family who get to view those and
Yeah.
make comments. So, yeah, LinkedIn is good.
and also join APAP, right?
Yeah.
The
Oh,
community
please.
there is
Yeah.
not only is you'll meet phenomenal people like Joe, but there's a lot of great psych PAs that are in that leadership network.
And we're
So
really making a big membership push right now. Tawana Lourdes is doing an amazing job getting
Mhm.
people in. She's just gangbusters, brilliant, charismatic. She's everything that we could hope for to be part of our organization, and I'm so grateful to have her. So I encourage you to go and come into the next meeting at APAP and check it out.
great. Well,
Yeah.
that's a wrap. Thank you again for sharing your journey.
Thank you so
Yeah.
much for having me.